Hello, everyone, and welcome to the Caregiver's Guide to Alzheimer's and Dementia series here on ZubiaLive. My name is Winslow Dixon. I'm a published author, holistic health practitioner, and geriatrics specialist with Alzheimer's and Dementia for the last 10 years. And today we're going to be discussing choosing a healthcare facility. I know that the diagnosis of Alzheimer's and dementia can be extremely daunting, and it's important to know what options are out there should you need them. So that's is the different types of facilities and how to best choose them. So I'm just going to go ahead and start with a few of examples of facilities that are out there. The first option that a lot of people don't know about is actually independent living. And I know that sounds funny because you think, well, independent living, isn't that just living by yourself? No, actually, there are independent facilities. And I use the term facility loosely because mainly these are communities. These are communities of elderly people, and a lot of times it's women or men that have lost their spouse that don't want to keep up with the big house, that don't have the family members to stay with them, and they just don't need all that. And so in their efforts to downsize, a lot of times they'll get a room or an apartment in an independent facility. And this is a really great option because it helps with that isolation, and it cuts down on things like cooking, and there's housekeeping. And, I'll give you an example. I worked in an independent facility, and there were a lot of ladies that unfortunately had lost their husbands, and they had these big houses where they raised their families and their kids had gone off, and then they suddenly found themselves alone in this big house. And their whole life had been taking care of their husband and their children, and now that that was no longer there, they really had to find a new sense of identity. So they moved into the independent facility, and they were able to join the community and make new friends, and they didn't have to worry about cooking and whatever. They had housekeeping, and they had their meals prepared, and they were really involved in the enrichment programs and were able to go and find new things and really renew themselves after they had had massive losses, with their children and their husbands passing away, and wives too. There were some gentlemen there. But independent living is a great option, especially if you don't want to live alone. So that's one option a lot of people really don't know about. The next option is an assisted living facility. Now, assisted living is different than skilled care, and I'll explain that. Assisted living truly is assisted living. There is an on-site medical team, usually it's CNAs and med techs, and they are licensed healthcare professional that will help you take your medications, take baths, things like that. There's 24-hour medical care in an assisted living facility. So that's something that's a little different than the independent living. Your meals and all that are also provided in assisted living. So it's kind of a step above the independent living, where there is the 24-hour medical care, and there's, a system of call bells and things like that. And there's a CNA team and med techs, and there's also nursing on staff. So assisted living is another option. Another option, especially for Alzheimer's and dementia, is a memory care unit. Now, these units are different because usually they are locked units. They're mainly meant for the care of later stage Alzheimer's and dementia. And the locked units are there, I know that sounds scary, but they're there for protection to prevent elopement. And elopement basically means sometimes in Alzheimer's, people can get disoriented, think they're in a different time or a different place, and they can kind of wander off. And that's a main concern with Alzheimer's and dementia. So these memory care units have a keypad lock. They're 24/7 medical care, and it really is a safe place for those in late stage Alzheimer's and dementia. So a memory care unit is a great option. Other facilities are like rehab centers. Rehabilitation centers are kind of different because they're short term, and they do employ a 24/7 medical staff, but they also usually employ occupational therapists, physical therapists, speech therapy, anything that someone would need, such as, post knee replacement care or post stroke recovery, things like that. That's kind of what sets the rehab centers apart, because it's truly a center that revolves around getting people to a better quality of life and recovering from an injury or a surgery. So the rehab center is a different type of facility. There are also things called tiered facilities, which is basically a campus that has all of these options rolled into one. I know that there are many, many communities that really have the gated community where there's individual houses that are independent living, and then they have centers for assisted living, rehab, and skilled care. And that is the last facility that we're going to talk about really is skilled care. Skilled care is, it can be short-term care, but mainly it's long-term care with highly trained medical professionals. The medications are given by licensed either RNs or LPNs, unlike the assisted living, which is mainly given by med techs and LPNs and medication aides. The skilled care is really the top of the line medical care for serious medical issues. It can be for short-term care, but mainly it's for long-term. So this is just kind of an overlay of, basically touching on the different types of facilities, but those are options for you. Let me just encourage you that if you or a loved one have been given the diagnosis of Alzheimer's or dementia, you need to talk about these things and review facilities early on. Because if things do progress and things do get to where there's a point where there's not a communication, you need to have a plan set into place beforehand. That being said, how do you choose the right facility for you? How do you know what's a good one? Because we all hear these horror stories, and I have seen it personally working in it, where these, elders are abused and this happens, and you don't want that for your loved one, and that's understandable. So I'm going to give you some tips on how to know that it's a good facility. As we all know, licensures and education is very important. And if you're going into a facility, okay, you can say, oh, we have this, we offer this and we offer that. But if the care team is not educated and licensed and wants to be there, that's going to impact your loved one's care. That's going to impact your care. So I would just encourage you that not when you go into tour facility, don't just talk to the management, talk to the staff. Talk to the CNAs, talk to the med techs, talk to the nurses, talk to the people who are there day in and day out. Get a feel for them. You can tell if someone enjoys their job. You can tell if someone has a passion for what they're doing. You can tell. And I would just encourage you to, like I said, not only talk to management, but talk to the people that work there. Ask them why. Ask them why they do that job. Ask them what would they offer your loved one if they were there. And I think that's something that a lot of people miss, because when you're in healthcare, when you're a part of the healthcare team, and I'm not saying that there are bad people everywhere, but unfortunately there are. So sometimes you have to really look beyond the surface. Okay, they might have a bubbly fountain in the front, but do they hire CNAs, med techs, and nurses that care about people? You really have to get into the grit of what runs a facility and what are the good parts about it. I would also look around at the cleanliness, look around at, have the sheets been changed? Are the windows clean? What is the food like? I would look at every detail possible, because the details are really what sets, a 4-star facility apart from one that's very subpar. Are the sheets changed frequently? Are they clean? Are the residents clean? Is their hair fixed? Do they look kept? These are the things that you're going to want for your loved one or yourself. You're going to want to be taken care of by people who care and by people who say, you know what, if this was my grandmother, I would want her to have the best care. And that's the heart that I feel like people need to have in this industry is, this is somebody's grandmother. This is somebody's mother. This is somebody who is very loved and very cherished, and you want to give that to them every day. And I would ask questions like, what do you do to give your residents dignity? How do you enrich their lives? Because Alzheimer's and dementia is a very daunting diagnosis, but you can still have a quality of life, still have enjoyable experiences despite the Alzheimer's diagnosis, despite the dementia. So I would go into a facility and ask, what do you do to enrich the lives of these patients? What do you do? So these are the types of questions that you really need to ask when you're choosing a facility. 4 stars on the door doesn't mean anything if the CNAs don't care. 4 stars on the door doesn't mean anything if they're not changing the sheets. 4 stars on the door doesn't mean anything if they're not getting proper nutrition, proper care. So let me just encourage you to be very, very thorough when you're choosing a facility. So like I said, there are different types of facilities: memory care, assisted living, independent living, and there are also caring from home options, which we're going to discuss further in this series if you want to tune in for that. There are plenty of tips on that. So I hope that this has helped you a little bit on little tips to try to find a facility for your loved one. Like I said, my name is Winslow Dixon, and this has been the Caregiver's Guide to Alzheimer's and Dementia. Thank you.